So Peter, tell us about what's going on for you. You were telling me you get some headaches and you have a scoliosis, and what's been going on other than that?
Mostly just the neck. Neck is like the cervical is not how it should be.
Yeah.
It's twisted.
Yeah.
That causes tension on the neck, shoulder, which leads to headache.
Yeah. Yeah.
Chronic headache.
Chronic. How often do you get your headaches?
Yeah.
How
often?
Yeah.
Once a week, I'd say, maybe once a month, or every other month migraine.
Yeah.
Heavily.
Yeah. Okay. Okay, great. Well, we're going to get you to lie facing up on the massage table. Actually, we'll get you facing down to start with, and we'll just have a feel of your spine.
Facing down?
Yeah, facing down. You want? Yeah, we'll just put this. So you could come in the shop now if you like, Jason, as well, and I can explain it to you if you like. Or what do you think? Yeah. We're still filming?
Yeah, we're
Still
still
yeah,
filming.
just got it, yeah. All right. So here with Peter's back, we can feel an awful lot of tightness just in there. You feel that?
Yeah.
Yeah. And on this side too. So let's just, wow, that's really, really tight through there. And then yeah, oh jeez. You feel that? Kind of vertebrae is just like.
Yeah, something.
Yeah.
It's a vertebrae.
Yeah.
It's like quite off center.
Yeah, it's quite off center. It's really coming out to the side. No wonder he gets those headaches.
Yeah.
Yeah. That's full on. Okay, so good. His spine is coming down like this. Okay. Right. So we feel, oh, jeez. There. Right. Oh, same on this side, yeah. But that side feels a bit tighter to me.
The inside.
Yeah, the inside.
Hamstrings.
Yeah, big toe sacrum band feels really tight. Yeah, his feet. Whoa, not a lot of movement there.
Yeah.
For a young guy too, that's
Yeah.
not that good. Yeah, okay. Let's get him to roll over if you don't mind, Peter.
And back.
Yeah, we'll just get you to come down the table a little bit. Yeah, that's great. Oh, yeah, look at that. Jeez. Feel that, Jason? Right in there. Whoa, steel table, eh?
Yes.
Yeah.
Like a bone.
Yeah, look at this.
Yeah,
This
I
is-
used to have a fracture.
Did you?
A
Yeah.
fracture.
You fractured this.
Yeah.
Okay, so, wow, he's tight on this leg too, yeah. Oh, big toes not, oh, there we go. They don't want to move easily though. It was,
Can't be toes.
oh, yeah, super tight in his belly. Yeah, oh, look at that, jeez, yeah. Maybe he's enjoying it too. Chest, whoa, look at the shoulders
That's
being
where I
pulled.
was digging into when I worked on
Oh,
his chest.
yeah, because you can see how like his
Yeah.
shoulders are so pulled forward. That's going to be affecting his heart chakra. Could lead to some depression. Could lead to some melancholic states as well.
Hunchback.
What's that?
Hunchback.
Hunchback. Yeah, it's going to be pulling you forward. So you know, geez, there's a lot of work here. You know, even though he's a small guy, right? Yeah. So you know, it's sort of a question of where do we start. I'd probably say we would start at his feet and just work our way up from there, restructure him from the base up. But it's going to take quite a few sessions, I would say. I'd say at least 10 hours to make good progress. But let me have a feel of your neck here. Just get you to take a deep breath in. Yeah, a couple went easy, but and again. And oh, this side to it. There we go. Feel there. How's that feel?
Yeah.
Also, I can see a lot of tension around his eyebrows.
Yeah,
I don't know, you see
the
that?
lines.
Yeah, yeah. His whole facial muscles look very, very, very tight. So, and also also consider starting with it, actually right in here,
Uh-huh.
this spot right here, third eye chakra.
Yeah, you can see it bulging in
Yeah,
that
and
area.
here, when I flick over that, it's,
Wiry.
yeah, it's wiry. So, yeah, I would just say, like, if we worked on, say, his big toes, maybe if you want to get started on his big toes, say, I'll get started up here, you know, we'll see what we can do in 20 minutes or half an hour or
Right.
something, right? I'll work his head, try and loosen him up. We get his feet a bit looser, and then we'll get into his belly, and then maybe we'll do some side twists on him to get his lower back into place once we've loosened up his legs.
Uh-huh.
And then, and also maybe some elbows in the hips and things like that.
Uh-huh.
But again, like I say, this is I would say 10 hours or something like that, you know?
Yeah. Okay. Let's see if we're all gonna get in. Oh yeah, great. Go to the chair.
There's another one, should be in my office, I think, which is at the very back there.
Attention can that also come from emotional stuff?
Oh yeah, absolutely. I would suspect, especially because you've got a concavity around your heart chakra here. Have you ever had any, you know, sort of, you know, fairly full-on depression or anything like that, or just, you know, anything of that emotional nature?
Yeah, before I started chanting before.
Okay. So, yeah, I would say there's some old emotion. It feels very tight. Like, I'd say this is old stuff for you. I'd say this is childhood, you know, especially if you haven't had a lot of deep excavation style or Raynor massage. I'd say this is very, like, been in there for a while kind of thing. Do you mind if I just move this out of the way just so I can get your neck nice and level? So working on the big toes is also very good because it is the reflex zones for the head, so for headaches and that sort of thing, it can be very beneficial. It's also the end of what we call bands of tension that are coming up from the big toes. There's several bands that are going to come up into your neck, and I'm going to come down there in a minute and work on one of the other feet and just revise a little bit of stuff with Jason there just to get him up to date with exactly how we're working at. But yeah, you got some serious head tension here. You feel those spots just in there? Yeah. When you get your headaches, where do you feel them?
It starts behind the eyes.
Behind the eyes, yeah.
And then it goes into the head.
Yeah, okay. Oh, you feel that?
Mm-hmm.
Yeah. Yeah, so definitely when you're over there in Kelowna, I would definitely go to Terry's clinic, and if you get a chance to see Tim or somebody or Terry.
Mm-hmm. Like a phone number thing.
Yeah, I think if you just look up raynormassage.ca,
Yeah.
they'll have a clinic. Otherwise, shoot me an email and I'll get his, I think I've got his email. Oh, like these bumps behind your ears and coming up into your scalp, they're full on. Let's get you to open your jaw. Let's see how tight your jaw is. Oh, feels very tight. Can you feel that at all, just in here in your jaw? Yeah. Yeah.
It almost feels like it's going inside the teeth.
Yeah, yeah. So much tension in here. And your ears. a lot of reflex zones actually in the ears as well. So even though the ears are cartilage, energetically they can hold a lot of tension. And a lot of people think massage is all about muscles, but it's not. Oh, your neck vertebrae are all over the place. This one's, you feel this one coming right out to the right here, and then, yeah, no wonder. Just gonna get you to take a deep breath in. You got a lot of tightness coming across the top of your shoulders here as well. That's gonna be coming from your thumbs. You work in construction, you were saying? Yeah. We have a storm coming up.
In his body or outside?
Sometimes the internal and the external, you know? Yeah. You don't when you jog in there. Jason's sitting under your toe.
Yeah, I thought this toe might have something. Yeah, right in here. I haven't got much reaction to his toes, so spot here.
I'm just be right back. Yeah.
So right in here, yeah, that was feels. Yeah. What's going on this toe?
Okay. So I'll just grab another chopstick and I'll come over.
I have, you have one? Oh, you got one. Maybe it's in there, isn't it? My tool?
No, I don't think so.
No. How charged is your phone? Maybe you can bring it over. recording while it's going, so it's probably not getting too much juice.
Yeah.